friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I am Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like you said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro Clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in El Dorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you.
Hello friends, we are Physical Therapy and we're coming to you on Louisiana Living. I am Angela Yarborough and this is Dr. Jerry Yarborough. And today we're starting a series on autoimmune diseases. So,
yes, ma'am. So you're a nurse by trade. So tell our audience real quick, what is our immune system? Just real brief.
Our immune system, it just keeps us well. It just keeps us well, keeps us from getting certain diseases.
Exactly. So within our circulatory and lymphatic system and all, we have white blood cells and other types of cells that fight diseases. So what happens with an autoimmune disease is the system starts to think that our normal cells are bad cells that make you sick, so they start attacking it. So our body starts attacking itself, creating all these different autoimmune diseases. And actually there's well over 80 different autoimmune diseases. Did you know that?
I didn't know that.
Yeah, I didn't realize there's so many. But there are a ton. And some common kind of side effects with autoimmune diseases and or origins, some are related to genetics a little bit, but most of them really seem to be more related to stress-induced, our lifestyles, our overall health, the food that we intake, and the environment that we live within. If you haven't realized yet that the environment that we live in, the chemicals we're exposed to, the air that we breathe, the water that we drink can affect our health and our bodies, well, it can and it does. And a lot of those end up being autoimmune diseases. So a lot of commonalities with many of them is, people will have pain, weakness, and a lot of fatigue.
most people with autoimmune diseases have to really schedule out their life and plan their days because they can only function for so long and then they start to hurt. Not all of them, but a lot of them have that commonality. So today what we're going to be talking about specifically the autoimmune disease rheumatoid arthritis.
Oh, so what's the difference between rheumatoid arthritis and osteoarthritis?
Yeah, so a lot of people get them confused, and osteoarthritis is really the normal wear and tear, destruction of our joints that the vast majority of us end up having at some point in our life. Normally, the older we get, the more likely you are to have osteoarthritis. And again, that's just from the wear and tear on our joints, where rheumatoid arthritis is an autoimmune disease where our defense mechanism starts to attack our normal cells, thinking that they're, disease cells. And with rheumatoid arthritis, it most commonly affects the joints, especially, the hands, the feet, the hips. But it can actually be even systemic and affect your lungs and even your skin. Rheumatoid arthritis, there's different spectrums or different types within a spectrum of rheumatoid arthritis. Like most autoimmune diseases, it's kind of like a spectrum. So why don't you guys come back in this next segment and we're going to talk a little bit more about rheumatoid arthritis and how physical therapy and occupational therapy can help you overcome your impairments that are affecting your life.
Welcome back to Therapy Thursdays. We are physical therapy and balance centers. And today we are talking about autoimmune diseases and especially rheumatoid arthritis.
That's right. So just a real quick recap, difference between osteoarthritis and rheumatoid arthritis. Osteoarthritis is a wear and tear process that we all kind of go through, wearing out our joints. So that's osteoarthritis. Rheumatoid arthritis being an autoimmune disease where our internal defense mechanism against disease starts to attack our body, and it causes these autoimmune diseases. So with rheumatoid arthritis, there's different forms and there's different degrees, but most specifically, it's going to hit people between the ages of 30 to 50, women a little more than men, and it's normally brought on either by stress or some other external thing in your life that kind of spurs it on. There has been some genetics tied to it and all that, but anyway, what it does is most often it's going to start affecting your joints of your hands and your feet, your hips, your shoulders, your elbows, bigger joints like that, and it'll start to cause inflammation of the joint itself, which can lead to bone erosion and even joint deformity. Rheumatoid arthritis can be extremely debilitating. So physical and occupational therapy play a very important role in helping manage rheumatoid arthritis. Alongside your medicine doctors and the medicine that they provide are extremely important. You don't want to not treat your rheumatoid arthritis. It can become even more debilitating. So with therapy, either physical or occupational therapy, now in the inflammatory stage of rheumatoid arthritis, you're going to just want to try to maintain motion and control the swelling through your medications. And when we have significant swelling, we typically want to try cold, but sometimes people with rheumatoid arthritis, cold hurts, so you may try heat. But typically in the inflammatory stage, you're going to try cold. Now just to manage your rheumatoid arthritis and the stiffness that come along with it, typically heat feels better, and people with rheumatoid arthritis typically do better in a warm climate. So further down south, they tend to do a little bit better. So again, we want to try to use heat to try to maintain or decrease the stiffness of our joints. It's very important that you maintain the motion of your joints, okay? And then on top of that, you got to maintain the strength because we know that, that God created our muscles to work with our bones, and they all have to do their own job, because if you have weak muscles, then it's going to put more work on your bones and cause those bones to deteriorate even more. So it's very important that you have a strengthening exercise regimen. All right, so you know, it's important that you have a good relationship with a physical or occupational therapist to help you set up a specific program to manage that, alongside, again, your primary care providers to manage your medications. And don't you dare forget about the foods you intake, because they can definitely increase the inflammation within your body. So I hope that helps you guys. And you know, come back next week, because we are doing a series on autoimmune diseases. So thanks for joining us today. Again, we're Physical Therapy and Balance Centers of Ruston, Jonesboro, and El Dorado.